I think every day when you're in a high school, you see the vast majority of the kids complying with the rules and expectations. So I believe as adults, if we set very clear expectations, that the students will meet those expectations. I'm also realize that we will have a student or two that will question the expectation. And if you choose to adopt this, you pretty much have set an expectation, or maybe another word is a rule. And if the student violates the rule, then we would handle it through the regular disciplinary procedure that a student would have to address if they violated a rule that the school has set through the school board policy or their own rule. So I will say, as you saw the young children at Conway, I have actually really good hope for our young people, because I've seen, I think I told you already, I've seen children of all ages, which I didn't see a couple of weeks ago, I have to tell you. There's been a pivot, wearing masks indoors and outdoors. So I have great trust that will happen. Yeah.
Any other questions? Oh, Ms. Randall and then Ms. Healy.
I kind of have a comment. Like I said, I think made things go a lot awry last week, and I will hold myself accountable for that. And apologize. But one of the things that I've talked to some of my colleagues up here, and Ms. Young has been an excellent example for us. And I would like to say that I appreciated the notion that there could be mask breaks. And in elementary, of course, they have recess. In high school, it's a little different for them. But I know that, help will be there. But the other part of this that you mentioned, it's a rule violation. But we have this new student code of conduct, which I think is helpful in having the conversations and helping the students to understand the safety, implications that not wearing a mask can have. And so I appreciate the fact that we do have this new code of conduct for students to help us, especially in light of something that might be challenging for especially the high school kids.
If I could just add on that, listening to so I'm giving credit to the health department of the Fairfax, okay? I heard this today, and I think it's a good reminder for all of us. And he challenged this Fairfax community. If you're concerned that the school board is taking these actions, this is something that you could help stop the spread in Fairfax. That all of us have responsibility. If the schools are going to be the only ones that are going to enforce, and this guy was very adamant, that masks are critical, not only in the school setting, but every street of Fairfax. So I do think that if we could get into that conversation with public, that we all contribute to the success of our school division and our community, I believe there's going to be a rise to meet that belief that we're all in this together.
Ms. Healy, I think I had you next.
Dr. Kizner, how would you define the facilities here? I think we need to be crystal clear when we're doing
so the football field, the football stadium, you're sitting on the stands, anything that we could say belongs to Stafford County Public Schools. Okay, so, transportation, the bus garage, central office, any facility that comes under your responsibility, you have care and control of, is a facility that this policy will go into place.
So what you're saying is on school property?
School property
owned by Stafford County Public Schools. I think that would be more clear, because I was thinking of an instance where students come in the bus, depart from the bus, between the bus and the entrance to the school. It may not fall under one of these categories, so you don't want the students to be wearing the face coverings on the bus to protect each other, then take them off and then go into school and put them back on. It might defeat the purpose. And I know that I've received, as we all have, a number of emails from parents that were significantly concerned about the students not wearing face coverings to perhaps change their their choice when there was a choice between a hybrid and a virtual. So I would feel more comfortable if we say on school property. And then, of course, there's always the exemptions due to the medical conditions and the other ones here. So we're not saying 100% everyone has to do it, but you have to do it unless there is a valid, exemption here. I think that would be more clear if that is the intent, and I certainly would be willing to support that. And along that line, Dr. Warner and Ms. Randall may not see any humor in this, but I say it with all seriousness. I suggest we change the will to a shall. which for years I've given the legal lecture, will means may and shall means must. And then, of course, the exemptions are part of this. So if there is a valid reason why someone, is not able to wear that face covering, that's not going to be required. But I'm assuming that someone is going to be monitoring the documentation of any exemptions that are being requested.
Dr. Warner, I think you were next.
I just want to say that I have always supported the face mask. I know that it's been difficult for many people to come to adjust to this, but the reality is that just the cloth masks, if everybody's wearing them and they're maintaining social distance, the risk of transmission is zero. So they do work. Just the nature of the droplets and the way that the infection is transmitted, masks are the most effective tool we have, so I fully support this policy.
Ms. Young, you want me to leave that to you?
Yes, no, I just wanted to comment on the comment about exemptions. So I know in February I was laughed at as the lady with the mask when I was entering Giants, and now everybody's wearing a mask. But exemptions, there shouldn't be any exemptions. If you need to be exempt from a mask, then you need to be virtual. Unless, of course, somebody's coming in that is disabled, then they should be free. Like, I know you're testing temperature and things of that nature, but then the questionnaire needs to be also 14 days. Have you been ill? Those kinds of things. We're planning on having that, right? I don't want to get into the minutia, but I'm watching. I'm looking at you, Dr. Kisner.
Well,
I'm just saying. I'm just asking, like, because there's parents that are saying if you're going to have a mask policy, and then you have exemptions, everybody suddenly. I don't want everybody suddenly to have like some kind of asthma or where. So I just need to know for those parents that are going to call me or send me an email. What are we doing?
so we have 30,000 kids. Some of our children, as we talked about earlier, based on their individual needs, a mask and maybe even a face covering, a shield, might be a challenge. Are there other ways, like having plexiglass to give support? Are there other mitigating ways to protect the other children and adults in the room, but also to provide that child an education in a setting? So and again, these exemptions are not original exemptions. These are coming from the Centers for Disease Control. But I just want to make that point is that the beauty of working with children is that every child's different. And we have to be looking at other ways of minimizing the risk. I am not suggesting by any means, and Colette, who's here, and I have talked about this numerous times, there are other ways of minimizing it, but also acknowledging, and you guys have been in the classrooms, I don't need to get into specifics, where we just got to come up with something else that allows the kid to be in a building and also allows the classroom to be as safe as possible.
Thank you so much, Dr. Kisner. I know Dr. Chase and Dr. Kisner, you're talking about Conway a lot today, but I just wanted to let you know that I was at North Stafford today, and they're looking really good over there in the way of how they're putting that social distancing together. And I did see that that EL class, and those were high schoolers, and they were looking pretty good with those masks also. So yeah.
I'm calling you 3 this morning just to give you I'm giving Susan a break.
I'm just going to make a couple comments. I will be supporting this change. I would like people to know that from last week, for me, I felt at that point myself unqualified to go further than the CDC. I'm a person who likes to reflect by and large on what we were doing. So it's been good to get some of those information. It does concern me, though, when we do talk about, some students of whether they can be in the building. I think that this policy is for 85 to 90% of our population is going to be, but there are going to be exceptions, and as long as, and it appears that Dr. Kizner has looked at, because both staff and students may have some exceptions. So what I want to be made sure is, I believe this is the 80 to 90% is going to be fully masked with some allowances within either certain classrooms or with certain particularities. I believe that our staff are equipped to make those decisions, and if they feel that they need guidance, that they have Colette and her staff ready to provide guidance. In that regard, I would like to just throw out that we probably will need signage and just some kind of clear expectations of what this policy means in probably a multiple language document. But I do think signage probably needs to be looked at. I don't know if that's in Mr. Anderson's area or not. But
Yeah, what I will offer the board, I'll talk to John Anderson and his team, an opportunity to visit schools. You'll see that we've purchased a lot of signage. You may already see it as you're visiting schools, but we're trying to, I told you that we're putting together videos, and so some schools we're making like our model school for the video purposes, but that's what you will see replicated in the other schools. But I will send you guys an email when we're ready to do that.
okay, any further comments on this? Do we want to take the recommendation that we would be students, staff, and visitors shall be required to wear face coverings at all times on school property? I don't know. Does that? Right, and to continue with the rest of that sentence. I believe Ms. Young, though, made the motion, but would you be willing to accept that as a friendly amendment? Or to that? Okay. And the seconder was Ms. Hollerback. Is that okay? All right. Is everybody clear then on the language? All right. All those in favor, please say aye.
Aye.
Any opposed? Motion carries unanimously.